resident. I'm actually one of those people, although it's protected by the Medical Marijuana Act, I'm here to tell you that I'm a patient. I work a full-time job. I've been promoted 3 times in the last 2 years. I just completed law school, and I have 2 wonderful children. So obviously, not all people who use medical marijuana are going to have an issue. But what I need you to understand is that where I live, I have no access to medicine whatsoever. I cannot grow my own. And so I come to Lansing, and there are some facilities that are really doing it right. They really are. They are validating your ID. They make sure that your card is valid. They are going through what the state requires them to do. And then there are others that I will not go in because I don't feel safe. And I think that that's something that needs to be taken into consideration as far as your statute is concerned. And as Mr. Hank had mentioned, there is going to be changes to our state as a whole, and that's something to take into consideration when you're addressing the public's concern about dispensaries and variances and all of the decisions that are in your hands at this point. And licensing, and making sure that that revenue can come back into the city for other things, such as potentially improving the 3200 South Washington area. I mean, there are a lot of things that could happen with this if it's done right and it's done smart. But what I just want to make sure that I'm going to have a safe place where I can get my medication. And while I look perfectly normal, I had a massive tumor removed from my spine 6 years ago. I lost a part of my nerve chain. I lost nerve roots. I suffer from an extreme neuropathy. And I have seen my doctor, who is a local doctor and in the city of Lansing, and he's been my pain management specialist since I got out of the hospital at U of M. I'm like 1 in 30 million with this type of tumor that I had. And I have something that makes me feel better. And we need testing, and we need to make sure that it's safe. And half the time, dispensaries don't even have what I need, which is something that's called like a CBD strain. But anyways, that's beside the point. So just keep in mind that you are going to be catering to people who live in communities outside of Lansing, and that's important. And you can lead by making it safe access for patients, or you can follow and not think about those things. But it's completely up to you guys. Thank you. Thank you.